to HIV.gov, published September 25, 2018, that more than 1.1 million people in the U.S. are living with HIV today, and 1 in 7 of them do not even know it, this is not okay. HIV, the human immunodeficiency virus, is a widespread infectious disease, and we as college students are not immune. This is significant as anyone can get HIV on this campus, and I just think that we should all know more about it. The severity of HIV is important to college students because when in college, you want to get an education, not a chronic sexually transmitted disease like HIV. With that being said, the time that one spends in their undergraduate career at Clemson University is a critical period of possible HIV contraction. After doing numerous amounts of research on HIV and its effects, I'm here to discuss how we can work together to minimize the number of students with HIV on Clemson's campus. The problem is that the incident rate has remained steady with nothing being done about it. In order for this to stop, a change must be made. This is why HIV testing should be made mandatory on all college campuses. To begin, I'm going to expand on the issue of HIV on college campuses. HIV is just another looming thing on campus. All students know about it, but choose to ignore it or just not talk about it. On Clemson's Healthy Campus webpage, there is even a tab labeled HIV/STI prevention that goes into depth on the importance of getting tested regularly for HIV, but until doing research, I didn't even know that this page existed. According to the Centers for Disease Control and Prevention, published the 20th of April, 2018, 8,541 youth received an HIV diagnosis in the United States in 2016 alone. 80% of this, which is 6,776 individuals, occurred in young people aged 20 to 24. Think of it like this. If 80% of Clemson students were diagnosed with HIV, this would be 18,725 students out of Clemson's total enrollment of 23,406 students. This would not be okay. Also, according to Melissa Healy in a newspaper article from Los Angeles Times, published November 28, 2017, 15% of Americans living with HIV don't even know that they have it. Most people live with it for at least 3 years before even realizing that they have it. Now that you see just how prevalent and serious HIV is, there's one thing that Clemson University can do to help its students before it is too late. The solution to decrease the spread of HIV is to normalize testing by making it mandatory at Clemson's campus and all other universities around the world. In a YouTube video from CBS published August 16, 2009, Monica Sweeney of New York Department of Health says that she thinks every person who steps into an emergency room should be tested for HIV systematically. The same applies for every student stepping onto a college campus. It is also important to acknowledge that some people do think differently, believing that testing should not be made mandatory on college campuses. According to Aubrey Kudzela and Malcolm Molyneux, both graduates from the University of Malawi College of Medicine with training in HIV medicine, individuals must be given the right to decide whether and when to be tested and what to do about it. They believe that testing a student against his or her will may result in the violation of ethical code. Those against mandatory testing also believe that it would be financially impossible to achieve and sustain at a level for it to even succeed. While this is understandable, the benefits of mandatory testing far outweigh the counter-arguments. Identifying HIV infections early will cut down the burden of complications that health services have to treat, and students who learn of their infection early can also start taking steps before it spreads. If Clemson sees that there is a high number of students who do test positive, they can then implement even more preventative measures and assist students before it is too late. So far, I have explained why HIV testing needs to be made mandatory, but I have also discussed some of the counter-arguments and why people do think differently. The problem of HIV not even entering the minds of a majority of students at Clemson can easily be fixed by making testing mandatory. HIV is not an individual's private infection, but it is a public health hazard for all college students. And the more we know exactly where it is, the better we can hope to control it. Mandatory testing not only helps our campus as a whole, but it could also reveal a person's status in time to allow for a more effective treatment. Currently, the CDC's Division of Adolescent and School Health collects and reports data on youth health risk behaviors and funds state and local education agencies and non-governmental organizations to help schools deliver health education, emphasizing HIV prevention, to also increase teen access to health services, and lastly, to establish safe and supportive environments for students. Just like the CDC is taking steps, so can we as students at Clemson University. When you leave the auditorium today, make an appointment through Redfern, or actually tomorrow when they open, but make an appointment through Redfern to be tested. Not only is it confidential, but it is also free through almost every insurance. With nothing to lose and so much to gain, there is really no reason not to. Mandatory HIV testing is a win-win for all college students, whether you are personally affected or not. One of your classmates or even one of your best friends could test positive for HIV, and the only way that they would know is by getting tested. Thank you.